Absolutely no non-segregated hospitals. They were all segregated in the Kansas City area. African Americans had to, if they went to the hospital at University of Kansas, they went to the Negro Pavilion. And it was known by other names: the barracks, the bags, the colored pavilion.
My mother was going to deliver, and the question was where and so forth. So they went to Kansas University. I think it was called Bell Memorial. That was the hospital at that time. It was much smaller than it is now. And this is due to the times we were asked to go in the back door. And I'm told this by my grandmother and my mother. If you knew them, there wasn't any back door stuff. We had to ride in the back of the buses. We couldn't do a lot of stuff, but she wasn't going to deliver her son in the back door. So they went to not too far from where we lived. We lived at 415 Everett, Kansas City, Kansas. And there was an old house called Douglas Hospital. She went there, and that's where I was delivered.
General Hospital would become Kansas City's only remaining inner-city medical center. The once proud Wheatley Hospital was abandoned and later used as a Halloween haunted house. Martin Luther King was transformed into a retirement home. To meet the overwhelming need left by the loss of these facilities, General Hospital would have to respond and evolve. Four men instrumental in that evolution are Albert Morrow, Dr. E. Gray Diamond, Nathan Stark, chairman of the Crown Center Redevelopment Corporation, and Homer Wadsworth, president of the Kansas City Association of Trust and Foundations. Dr. Diamond credits Stark and Wadsworth with the creation of Hospital Hill.
They would think of ways to implement something that I don't know how to really go out to people into a tin cup and raise money. And Nathan, representing Hallmark, which is big money and charitable, he could go and speak to people for money and get it. And Homer could provide him with the reasons.
Homer Wadsworth was really a genius, because when the city again got themselves in financial trouble, he went to lunch one day with his city manager, Bob Weatherford, and said, look, why don't you consider having the city contract for a not-for-profit corporation to run the hospitals for you, with the intent of using that to get a medical school in Kansas City.
I like to talk about that because I came up with that idea, and I pushed hard once we had the bond issue money to give that money to the University of Missouri and tell them that we wanted a medical school here in Kansas City.
The new UMKC School of Medicine would initially use the General Hospital building for training, but plans were already underway for a new state-of-the-art facility.
Nathan and Homer visited with Mrs. Truman, the president had died by then, and said, we're going to build this new hospital. We'd like to name it for Harry Truman. She said, you can't name it till you build a hospital. But I don't want you using his name, and you don't get it done. So the commitment was we had to get the money to build a hospital. When that happened, we could then formally name Truman Medical School, because it signified everything he believed in. I mean, this is truly a representation of what his value systems were, and she knew that.
On September 8, 1973, the official groundbreaking of Truman Medical Center was held. Longtime healthcare advocate Senator Edward Kennedy was the keynote speaker.